There are multiple reasons why someone may be recommended for cardiac imaging, and that decision is based basically on a clinician's assessment of the medical history, physical exam findings, symptoms, and the overall risk of the patient. And some of those symptoms and findings include chest pain. So when a patient experiences chest pain, it may be coming from the heart. There are various tools we would want to use. Stress tests, we can now look at coronary arteries individually. Sometimes it's the sac around the heart called the pericardium that we can see very well with MRI. So those are tools that can kind of elucidate from a chest pain capacity what's going on with the heart. Heart failure is very important to recognize. Heart failure has serious prognostic implications. Heart failure can be assessed typically with an echocardiogram or with MRI. It gives us that number called an ejection fraction, which is the percentage of blood that leaves each heartbeat. Knowing that number helps in that prognostic assessment. MRI gives us additional tissue characterization to try and elucidate what that cause of heart failure is. On physical examination, we may auscultate a heart murmur. Heart murmurs are basically sounds that are disrupted flow. So flows that aren't happening in a normal capacity and typically relate to a valvular abnormality where a valve's not opening or not closing very well. An echocardiogram is very important in that setting to find out what valve is affected and how severe that valve is affected to know whether surgical intervention is necessary. Irregular heart rhythms, we call palpitations as a symptom, can be detected either through an EKG or through auscultation. Finding those rhythm abnormalities can be important in terms of diagnosing what is a riskier form of a rhythm abnormality. So if a patient has significant risk, whether it be a genetic risk through family history or through comorbid illnesses like diabetes or hypertension, it's very important to identify that risk early, and we can use imaging tools to assess that risk. And finally, we will use cardiac imaging in the cardiac risk assessment for procedures, typically surgeries. So if someone has a high enough surgical risk, we want to make sure the heart's doing well, whether that be from a blockage perspective, so they don't have a perioperative heart attack, or from a heart failure perspective to know their heart's strong enough for the procedure.